Morning, Prof, Doctor, ladies and gentlemen. I'm Jun Sin, one of the alumni MD UKM batch 2016-2021, and I will be moderating the live forum session today. First of all, let me just briefly introduce the brilliant, unique, outstanding Yuppies, also known as the BUOY project. The BUOY project is a collaborative project between Akademi Dr Har and alumni MD UKM batch 2016-2021 that aims to provide support to fresh medical graduates during this challenging time of COVID-19 through virtual platforms. This will be a 4-week forum series discussing on housemanship, medical career, and specialization pathways. Today, we will kickstart with the first forum series entitled End of Medical School, What's Next? Together with us, there are 3 honorable speakers. Let us welcome Prof. Dr. Harlina Halizah Siraj, the founder of Akademi Dr Har. Morning, Prof.
Good morning, June. I'm so excited to be here, especially to be with you and the other 2 gentlemen. Okay.
Dr. Fauzi Md Anshar, the consultant respiratory physician of the Prince Court Medical Center. Morning, Dr. Fauzi.
Good morning, June. Thank you for inviting me.
Dr. Mohamad Nurman Yaman, the head of Department Medical Education UKM. Morning, Dr. Nurman.
Good morning. Thank you for the invitation to assist you in the early journey of a medical career.
Before we begin, here are just a few housekeeping notes. Today's forum session will be recorded to be available for viewing post-forum. If you have any questions for the speakers, please do not hesitate to submit your question through the chat feature in Facebook and YouTube Live. Our speakers will address your questions after the session. Without further ado, let us start the forum session today. First of all, I believe most of our audience today are waiting for housemanship. So first question, Prof. Har, do you have any suggestions for us? What should we do during this waiting period?
Okay. All right, June. Thanks for that question. But before that, I guess as the founder of Akademi Dr Har, I'm more than happy to sort of collaborate with all of you. I know that you might be now wondering what to do with your life. It is actually the beginning of a new chapter. Once you graduated and got your MD, that was actually the closure for that chapter, and now it's an opening of a new chapter. And I was just thinking that you all should have some kind of discussion further to assist you. So thank you for willing, for June and Liling and Liren, especially from the batch. And I would like to welcome everyone. I think that's your senior there, Trevor Chan. And maybe Trevor, you can actually give some input in the comment chat. So well, basically I would like to just go back about 30 years ago in 1991. Sorry, you all, I know you are just rolling your eyes. Okay, but that was the time when I was your age, June, and I was so freshly graduated. But you see, I got married 1 week after I graduated. So it was really an exciting time for me because I actually had only about 2 months before I sort of register for my housemanship. I was called to duty exactly in August. So on 2nd of June I got married. So, and that 2 months was actually a crash course of living with another person, and I really make full use of that. But I guess that goes with everyone, once you close that chapter and are opening a new one. So I guess you would have some kind of idea what you want. And for me at that time, I'm going to be a professional. I'm going to be a wife at the same time, and I'm ready to start off my journey. So I just want to open it that way because I'm sure Dr. Fauzi and Dr. Nurman has their own experience as well when they were, at that time, just like you, June. Okay, I'll stop there.
I believe all of us are excited, at the same time worried to start this new chapter. And how about you, Dr. Fauzi? Do you have any recommendations? Can you just share with us your experience?
Okay, thank you very much, June. First of all, congratulations to all the MDs. Welcome to the next chapter of your life. It's going to be wonderful, challenging, full of ups and downs, but Stick with it. Inshallah, you'll be okay. Right now, your time is definitely different from my time. I graduated about 25 years ago, and previously during my time, Prof. time, maybe Dr. Nurman's time, our jobs were secured. We already knew what we're going to do, where we're going to work before we finish medical school. And so to me, I'll keep it short. Okay, it really depends how much time you have. If you have a short time, then do the social things first. For example, after I finished medical school, I proposed to my wife. So you can propose to your sweetheart, and, do the necessary things. Sort out your finances, go on holiday, look after your health, start planning health, finances, things like that. Important things in life. Now we know those are important things in life. Previously, during our time, we may not have realized health is important.
Yeah.
Eating
Yeah.
well is important. Keeping trim is important, for example. But if you have a long time, like now, maybe June, have you got a job yet? Not yet.
I'm currently working as a research assistant. Yeah.
Okay, so in terms of job, being a house officer, have you got a job?
No, haven't.
So
They're
you're
still
still
waiting.
isn't it? Okay, the
Yeah.
waiting time can be 6 months, can be 1 year. Is that true?
Yeah.
Right. Okay. So if you have a long time, then according to Covey, Stephen Covey, sharpen your saw. Yeah, sharpen your saw. You can't afford to lose the clinical skills that you have. So your clinical skills, also depends on the other things as well. Computer skills, communication skills, writing skills. So do the social things first. If you need to, propose to a sweetheart, get married, or whatever else, or your finances help. And then, like what you're doing, June, get some experience, get some money, and also enjoy life. Okay, that's from me.
Okay.
Thanks for the suggestion, doctor. So as Dr. Fauzi mentioned, now the housemanship waiting period is long, six months to 1 year. So Dr. Nurman, perhaps you can share with us, what do you think, like, is there anything we can do to polish our clinical skills this time?
Okay, thank you very much. I glad to hear the experience from my two, I would say, mentors, Prof. Har and Dr. Fauzi. Uh, then they got married after graduation. But for myself, I got engaged in fourth year. I got married in my beginning of my final year. So basically, I think before I start working, I spend about because it's a PJJ, perkahwinan jarak jauh, between two Northern Ireland and then in mainland UK, because I was graduated in the UK. So that about 1 month time is basically is to stay together after getting married, and just like what Dr. Fauzi have said, it's the social thing that you have to do because that's your biggest support in your life, the beginning of your support until now. And Alhamdulillah now got married for the past 20 years now. So Alhamdulillah. And for information, I just got back from Umrah and spent time with my wife for 13 days. I mean, returned back last week, Alhamdulillah. In terms of what to do after graduation and before housemanship, I just want to share the two things that I mean personally know. Two person I personally know. One person is someone graduated from the local university private. She, I mean, she graduated in April because she knows that the waiting time is maybe 1 year or I think more than that. So what she did is she enrolled into a master program. She did a master, not the clinical master, but a science master. But this particular master is a master in medical education in USM, and she completed her master, and then now she's a housemanship in HCTM. That's one way of you looking at it. Basically, you try to gain something to increase your value. And this kind of candidate, because I'm currently the head of department of medical education, I really want this kind of candidate to join me because of she is determined to be a medical educationist. And another person that I know is involved in NGO. I don't know whether I think I just said the names. Haziq is in your batch, is it? is Hazington is your batch? Yeah.
Yeah,
So
yeah.
so now he joined the Med Treat My NGO as one of our exec to run the show while waiting for housemanship. So that will definitely improve his uh, I would say um skills, communication skill, management skills. That is really needed when he become a houseman. And there are a lot of other examples, like even my I would say my cousin, he joined the jual susu tepung while waiting,
Mm.
and he earns about, if not mistaken, about 3,000 per month as much as the houseman. And then but now he's a HO now lah. But he's a MO now. He just completed his HO. But there's basically there's a lot of things that you can do while waiting rather than just sitting down. But obviously the social thing, I mean, after we gone through COVID, the social thing is a must where we need our mental health to be secure and everything. But basically nowadays there's a lot of things that you can do. A lot of opportunities rather than just sitting down at home watching Netflix 24 hours, 24/7. And then you can improve a lot of things: communication, your interaction, your management, while earning a bit. Then when your life as a housemanship starts, then you might miss the time that you have spent before. So that's from me.
Thanks, Dr. Nurman. So I think I should really actually plan properly for my social life after this. And
Ooh,
Go, June.
you may not get much social life during housemanship.
Yeah, you will not get
So
this kind of time again.
and as suggested by Dr. Nurman, actually we can become joining a master program or even joining NGOs. But as we know, like becoming research assistants or joining master program, the period is quite long. I think might last for 6 months to 1 year. And may I know, like, for Dr. Fauzi, what is your point of view regarding deferring housemanship for the purpose of research project completion? Yeah.
Okay. In, during my time, okay, I'll talk from the UK point of view and also from the Malaysia point of view. From the Malaysian point of view, it's actually a stigma to defer housemanship years and years ago. After graduating, it's a must for you to start working, start earning. If you don't, there's something wrong with you. But in the UK, it's common to have gap years. During medical school, you can take gap year, travel, do research projects, get enroll in a master's program is quite common. In Malaysia, it's unknown. But now, with the current situation where housemanship can be delayed, so it all depends on your circumstances. Uh, Most of you will have deferred housemanship, isn't it? Is the minimum? What's minimum waiting time now, June? Is it 6 months or
Yeah,
longer?
6 months, I think.
6 months. Okay. So deferring housemanship is a must. Yeah, it's been put on you. You have to defer anyway because of the such long waiting time. And many of you will not have a job lined up. You don't know where you'll be working. It's up to Putrajaya to send you to whatever places that you have applied for. So I think depends on your social circumstances. Since deferment is almost mandatory now, you must have a medium term, short term, and long term plan. To me, this is what I did as in the final year medical student. I put a rough timeline, rough milestone. So my milestones were a few and very simple. I wanted to graduate. I wanted to get married, so I proposed to my wife after graduation. I wanted to specialize. I knew I wanted to become either a pediatrician or internal physician. So I chose to become an internal medicine physician. I wanted to perform Hajj. I managed to do that during specialization. And I wanted to return to Malaysia to serve my country and my people. So those were the five rough timelines. And managed to do all that. I managed to get all that. So have a rough a milestone and timeline in your mind, in your heart. You know what you want to do. So that's a long-term plan. A short-term plan, as I said, sort out your social life, financial health, mental health, things like that. You know yourself, you know your body, you know your mind, you know your spirits. So try to do a self-check, do a self-diagnosis. Is there something deficient in you that you need to correct yourself during this time? And to me, sorting out your social issues, your mental health, your physical health is a must before you start uh, working. So I think if you do that, I think you'll be in better stead to enter housemanship properly, strongly, mentally, physically. And then I agree with what Dr. Nurman said. Do something useful, whatever it is. But look at the important things. To me, communication is very important. So what can you do in order to improve your communication skills? Enroll in a course, do more presentations, do lots of readings. Reading is a must. It's not optional. You must do lots of readings. I wish if I were to repeat my husbandship, I would do more networking, join NGOs, be more active, know more people. And what is important is you need to know not just your own people of your own age. I think you need to try to get to know people who are older than you, are more experienced, because there's something called riding the tailcoat of someone. So when I was working, I look up to the more experienced people. I worked hard. They knew that I was a hard worker. So they invited me to join them to do certain projects, to start training me, to do certain procedures that they wouldn't offer anyone else, for example. So identify what you're good at and just do more. Get to know more people who, especially people who have more experience, because they will sometimes offer to be your mentor. They will give you gems, pearls that you cannot get anywhere else. So to me, do more. And don't fret if you get into a situation where, alamak, leceh lah kerja ni, tak nak lah kerja ni. There's always something to be, some gems, some hikmah behind whatever that you end up and wherever you end up. There's always something there that can be found. I'm sure other speakers will, the other panelists can also relate to that.
Thanks, Dr. Fauzi, for the input. I agree with you that we should have personal aims in life. And I think we are so-called the pandemic generation. And even back in med school, our clinicals were often interrupted because of the pandemic. And I believe many of us are quite worried whether we are competent enough to become a doctor. So, Prof, is there like, do you think other ways to improve our clinical skills? Sorry, Prof, you're muted.
Sorry. Okay. Rightly so that your batch, the so-called pandemic cohort, seems to have a lot of difficulty and interruption during the clinical training. Yeah, I'm sure Nurman and the then Deputy Dean of Academics, Prof. Roslina, was having cracking their head, and trying to sort of, and we have to extend the whole session because you're just not, getting enough credit hours, to sort of make you eligible to sit for the professional exam. So okay, that aside, now here you are with that kind of shortcoming. I guess we realize that because of the the restriction of going to the ward, you all are getting better, especially in the theoretical component. Okay, that is what, when we analyze your theoretical tests and exam, seems to be much better than the rest of the cohort before this. But of course, with the disadvantage of not having enough clinical exposure. So I guess that would be Dr. Nurman's, most likely area to sort of relate that. Of course, we as teacher, we still have that responsibility to make sure that you are well prepared especially for the practical and the clinical competence. So then that would be some of you actually pass. However, the practical might be, it can be improved and should be improved before you go into your housemanship. But of course, Minister of Health as well has to anticipate this, because it's not just you, June, from UKM. It's happening the world over. Okay, and hence all the healthcare delivery system has to be prepared for this generation of doctors who might need to have a very intensified kind of training while on the job. And for me, now that I listen to your juniors presentation in my clinical teaching ONG. So now can just like yesterday, Nurman and Fauzi, I had 9 students presenting their cases, their introduction. Out of that 9, 4 actually presented a case of a patient, obstetric patient who has COVID-19. COVID-19 positive at 12 weeks, COVID-19 positive at 28 weeks, Cat 1, maybe Cat 2. One is actually Cat 3A. So this is really new things, yeah? And for me myself, I can only imagine, okay, at the end of my career, as before my retirement, I can imagine the kind of landscape that is going to be different. But it's okay, June. I think it is actually more exciting than ever. And of course, we are all COVID survivors, and you will actually have a lot to tell your grandchildren about this time. During the pandemic COVID-19, I was the final year student, and blah 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 blah. You can even start writing your books now, June. Yeah, so I might not have the exact 1, 2, 3, 4 tips and recommendation, but I would just put it that this is a very exciting time to live. Yeah, and all the best. Okay.
Thank you, Prof. I believe this pandemic actually provides us with a different experience compared to previously. How about you, Dr. Nurman? Do you have anything to add on?
Okay, I think just what Prof Har mentioned. In medical education, there is what we call simulation. I don't know whether you are aware that we also have basically we employed tutor, which are final year students are waiting for housemanship to guide the juniors in the basic simulation lab in how to do the clinical skills. So that's one way of basically if you want to enroll into the program, it's a tutor program and currently handled by Dr. Hafizul. So at the same time, well, because when you teach someone, basically you are practicing for yourself as well. So when you see someone, when you teach someone, you will remember for the rest of your life how to do. And as we have a very good simulation lab at level 4, I believe all of you have using it during during the PKP time. So that's one way of doing it. Because I mean, you are our graduate, so I believe I mean, I don't think we prevent you from coming, but just make sure that you can apply to us lah. So basically, that's one way of try to maintaining your clinical skills. Because I mean, like for me and Prof Fauzi, both of us are from the UK. Sometimes we just go straight into the system without a very long gap. But as what Prof Har said, that not all of you are excellent. I'm sorry to say that just because of the COVID area, I have to tell the truth that not everyone are very excellent in the clinical skills upon graduation. And furthermore, and the gap, basically you will lose the skills if you don't touch any patient at least for 6 months. Even like for us, like myself, sometimes I hope that I still remember my clinical skills, even though I have left about more than 10 years. But these are the things that you tend, because for me, because I have gone through but basically around 7 years of fully clinical, so I have my knowledge, my I would say background knowledge of clinical skills. But for you guys, you are still doing it at the first time as a houseman. You don't have the skills yet. If I can show it, like for example, for between first year and second year, okay, when you are in the first year, you just started your PBL face to face, and in your second year, you are also basically you are automated because you know how to argue, you know how to discuss, you know how to present. Imagine since 2020, where there is a first year student coming in, they never seen their friends in PBL session, and what they know is they just talk in front of the screen like this. So they don't know how to argue. They don't know how to communicate. They don't know how to. There's a lot of skills from the PBL. So putting them straight into online and expect them to perform PBL successfully like the previous years, uh, it, it won't be achieved because they have never been in that situation. So that's why for people like for secondary students who are first year, they have gone the PBL physically. So the second year, they have some knowledge of how doing it. So same as you going into housemanship, I believe the COVID have changed a bit. I mean, changed a lot, I believe. But try to learn from and what you try to learn from COVID, because the technology is far greater now compared to 2 years ago. Internet obviously faster than 2 years ago. Apps are there. A lot. Even now, we are doing this face to face online, and this has more penetration to the public compared to if we want to organize this uh, at the faculty. So obviously, or maybe, or saya tak boleh lah, saya busy. So you need to change the people, you need to change the speaker, and then you want to ask your friends, or some of your friends are not available for the whole day, they're only available for a few. So these are the lessons from COVID that you really need to get and master before you can try to start working, because this will be a very valuable skills in the future. So combining simulation, combining your IT technology, combining a lot of you have learned in the past during ini, I believe you'll be a better batch, to be honest. Because so far, I think
Yeah.
your batch is the best batch so far in the history, to be honest.
Yeah, yeah. I totally agree.
Yeah.
Okay.
So don't despair. I mean,
Thanks.
learn a lot of things. Just what Dr. Fauzi said. Learn a lot of things. Try to get anything before you start working.
June, can I just chip in maybe before you ask Dr.
Yeah, sure.
Fauzi? I think
Yeah.
the medical consultation is going to change a lot as well. There will be a lot of online consultation. And I guess, housemanship might not be as how it was before. Okay, so they might be a little bit more on streaming, the medical doctors into whether you are going to be face to face or handling the telemedicine, isn't it, Fauzi? These are things that might just branch out, and you just do not know, how far this can go. Okay.
Thanks, Dr. Nurman, Prof. Har. And I agree, the simulation labs actually help us a lot back in med school, especially in helping us to survive through the clinical years. And I shall share to my batchmates around that we can go back to the sim labs to practice our clinical skills. So back to you, Dr. Fauzi. Do you have any other point of views regarding like how to polish our clinical skills?
Right. Thanks. I have a number of things. I need to organize it in my mind first. Your batch and future batches are totally different from us. You are the pandemic batch. You are born online. You know how to handle online things much better than us, really. So housemanship may be different. You may be trained to be online doctors even in the future. Who knows? And you may be very good at that. You may not be very good at doing clinical stuff. You may be thrown into the deep end trying to do things. But let me tell you, there's nothing like the challenge of being thrown into the deep end. I can relate to experience. When I was promoted to become associate professor in UCAM back in 2009, suddenly, boom, H1N1 pandemic occurred. So I was in charge of H1N1 pandemic, being a clinician, and with cooperation, and I needed cooperation. I needed to cooperate with UCAM Bangi because they were screening students in the tens of thousands coming into UKM, Bangi, UKM, and other campuses as well. I needed to collaborate with other doctors in other specialties, ED. I remember having daily meetings, sometimes BD meetings with Professor Ismail Saibun in ED, trying to sort out the pandemic and the things, the policies, the protocols that change from time to time. And the same with COVID. I was thrown into the deep end, and I've been looking after acutely sick COVID patients. I didn't know much about COVID. All I knew is a viral infection. So I had to learn. I had to.
Nobody does. Nobody did, and nobody does.
No one knew. We may have made mistakes in the past, and even the so-called experts didn't really know what's happening. It was trial and error. Look at whatever research data that was, and but the thing about COVID, there was an explosion of online collaboration. Yeah, so explosion. We were overwhelmed, and I had to combine all that clinical online learning, talking to people, collaborating with other experts, and looking after COVID patients myself from category 1 into category 5. I still remember the first, previously, private hospitals weren't allowed to look after COVID patients, but the government couldn't cope anymore. And I remember after being quarantined as a close contact because my wife and my son had COVID, the first day I returned to work, straight away I had a Cat 5 patient coming into ICU. So I had to learn very quickly. So in the 2 weeks I was quarantined, I had to do lots of reading. So with that reading, online collaboration, looking at lots of webinars, I managed to look after that Cat 5 patient, and he walked out alive. Thank God. And I used medications I've never used before, favipiravir, tocilizumab, and I had to hone the clinical skills that I've learned in the past, looking after viral infections, bacterial infections, how to manage hypertension, diabetes, other chronic diseases in the ward. And that patient had about 5 past medical histories. No, 5, maybe 10. Splenectomy, hypertension, diabetes, ex-smoker. My God, and trying to do that in a full TIVAC in that heat in ICU, for example. Okay, our ICU is air conditioned, but having to work in that condition totally changed the way that I look at life. So your pandemic generation is going to be totally different. So again, nothing like being thrown into a deep end, but hone into what the skills that you have, improve on what you think is deficient. So you need to be honest with yourself. How good am I? And this is where self-reflection. I remember Prof Har doing PPD, reflecting on your weaknesses, do a SWOT analysis, and then take it from there. Always collaborate. You're not the only person working there. Ask for help. So to me, asking for help is one of the greatest virtues that you can ever have. Okay, so good luck to everyone.
Thank you, Dr. Fauzi. And things change over the pandemic. And I believe becoming a doctor is always about continuous reflections and lifelong learning. And thanks for the inspirational story just now. Okay. Since we have discussed about preparations prior to housemanship, so now let's move on to entering housemanship. And I can foresee there will be lots of challenges ahead. So maybe Prof, can you give us like some tips on how to persist through this special journey?
Okay, thanks, June. I would like to just give this one very important tips. Whenever you come to you being the new kid in the block, you must always remember that you are there to learn first, okay, and that will change the whole perspective. That will actually put you into your growth mindset. Then you would actually display a very a conduct of behavior that is more or less parallel to that as well. So I would like to sort of advise that you have to come in being humble, and you must always remember that everyone there, in the ward or in the hospital, they are there to help you. Okay. Of course, we feel very vulnerable actually, June. Okay, when you don't even know what you don't know. Okay, and you might, well, of course, now you have your friends, but later on you will be the only UKMMD that is going to be posted there, and you have to start making friends, from the first minute. Okay, so I think this is something that you don't learn in the books. It is you, it's you yourself. Okay, so I remember maybe just a little bit of um that first day of housemanship. I was actually posted to HKL. Yeah, and of course we have to report to the pengarah, Fauzi and Nurman. And there, at that time, there are 6 new house officer for the whole hospital. Okay, there's 6. 4 of us are actually from UKM and 2 more from UM. I do not know why USM wasn't. I think they actually came in later. So we were looking at each other. I know there are the 4 friends. So they are all my friends, and in fact, HKL is actually our playground. But the 2 UM were really looking, very, very scared, and we were just smiling at each other and said, "Don't worry, you will survive." And I guess these 6 of us, we have become very close friends. So I was posted to pediatric. Okay, so I was given I will be in pediatric. I mean, that was the first batch of housemen that was sent to the new Institute Pediatric. That was in 1991, August. They just opened in June. So that was even very new because as a medical student, I never actually posted there as well, So that's something new, Fauzi. It's something that, I know that I'm going to be thrown into the deep. Then we waited for 1 hour for the director to come by because, the director actually totally forgot, and he forgot about us. That was the time, reality bites. Then I realized that even though I was feeling very important, I have my new clothes, my new white coat, my new name tag, everything is new lah, from inside out. And then suddenly I realized I'm not so important because the director forgot that we are coming in. So we waited for 1 hour, and we were actually waiting in front of the PA of the director, and we could see, she was calling everyone. Yeah, because the director cannot make it, and he was away, so he called one after another. And I, as the who's the child train in HKL, I know who this PA contacted, and all of them turned it down. And finally, she has to call Datuk Zaki Murad, again, who is the nephrologist. So and he came. Even though we know he was very busy, he was in the dialysis unit, but he came. He was not happy, of course, and he came and said, "Okay, guys, I have only 5 minutes. Okay, come." It's a kind of initiation. So he didn't even offer us to sit down. We were all standing, facing that whiteboard, and he took up his, the marker, and he drew a pyramid, and then he made, layers on that pyramid. So he says, "You are the house officer, HO, right down at the base of the pyramid. And on top of that pyramid, this is me, the senior consultant." Okay, and in between this, you have your MO, you have your registrar, you have your, specialist, and then you have your consultant and senior consultant. Okay, you are at the base of the pyramid. You are the lowest in the hierarchy. I can still see, and hear the sound where he was tapping on the whiteboard. So you are the lowest in the hierarchy. I felt so small then. But I will never forget this. He said, "But you know what? This is a very fair profession. Everybody starts here. If you see me today as a senior consultant and a good one, an excellent one, it was because when I was a house officer, I was an excellent house officer. You are," and he was pointing at all 6 of us, "you are the most important person in the team." Oh, suddenly, you feel small and you suddenly feel big. And then, because we all depend on you. You are the one who hold the fort. And if you are good, the whole team will be good. And then Okay, so I trust that you can actually. But that was the the motivation that I will always go back to when I was at my lowest during the housemanship. Okay, and before he left, he said, "You see, nobody is parachuted in to be senior consultant. Everyone starts here." And then that was really so. I guess, and that actually June put me in a right mindset. So I went to the pediatric institute PEDS. I reported to the head of department, and I was sent to a medical officer called Mina. I remember Mina was the most senior, and Mina was very friendly. You know why? Because they were actually left with two housemen, and these two housemen has been on daily call every day for the past 2 weeks. So she was really looking forward for the two of us. I came down with another person. Just so I said, okay, Harlina and another person, one of you has to do your call today. Then there was no thank you whatsoever call today, and the other person was actually from So I know I have to be the one because I know the system better. So okay, you nak want to som ke you nak volunteer? So I just put up my hand, and he handed me the pager. Wow, that was my first time holding the pager. Feel suddenly very important, but then I think half day I just want to flush that pager, in the toilet, because it did not stop, you know, everywhere. They keep on paging. But Mina said this. Halina, remember, if you are willing to learn, if you are humble, we are all here for you. But if you're just so stuck up, snobbish, and you just want to, you know, just showing your air around, will make sure your life is difficult. Okay, so I stopped there first, but I know, and she introduced me to the nurses. I said, Halina, be nice to your nurse. Be nice to your nurses. They are the ones who's going to determine whether you are going to have your breakfast, lunch, or dinner during your call. I didn't know what it meant actually, June, until my calls. Then I realized the nurses are the one who actually taught me. Not really I my first prescription for the discharge. The staff nurse in charge was looking at that prescription, and then she called me. Dr. Halina, kejap. This usually can daily dose je, but you are giving it 3 times a day. Kojol the patient. Itu nanti doktor. Can you rewrite this prescription? Tak? Oh, that's she could just embarrass me, in the middle of the ward, but when she was very kind. Okay, June. Right. All right. Are you lagging, June?
Okay. Thanks, Prof. So
Okay.
I believe we must stay humble and don't afraid to make mistakes and continue to learn throughout this housemanship journey. How about you, Dr. Nurman? Do you have like any memorable experience during this housemanship? Do you mind sharing with us?
Okay. I do remember my housemanship years, because my first posting is surgery and vascular. I was posted in Scarborough Hospital in the UK. Uh, the difference between there and here, over here you have the tagging for I think few months, but over there's no such as a tagging. They expect you to be full blown housemanship on day one, and I was on call on day one in the surgery department. And at that time, there's only six, if not mistaken, six housemen looking after four, or I think after looking after 6 wards, but only two housemen for 2 wards. So they allocated 2 housemen. So I've taken care to 2 wards, and then the rota for on call. Even though the on call is a half day shift, but I mean, minimum 12 hours to maximum of 14 hours. Unlike Malaysia style, it's a 24 hours following the next day. But you are always on your feet for the whole time of the on call. And usually my on call was at the time so 1 in 3. So on call tomorrow continue what is been on take yesterday, and then then follow up, and then on call again. So at the time it's a 1 in 3, because I remember I got band 3. Band 3 is the highest and the most, I would say at the time, the severe on call rotation at the time, before they reduce it to 1 in 4 and 1 in 5 at the time. So I remember my consultant, Mr. Barry, everything is a vascular surgeon. During my first week, they expect me to know everything, and by that time, that's what Prof Hai said. I must know where I am in the hierarchy. Basically, I'm still lower than the nurses, because the nurses are there for many years. They are very experienced. So at that time, because of I think the way that the education system over there have taught us, basically when you are in the final year, will teach your juniors, and when you are a house officer, you will teach your final year. And then the things that I remember from my seniors saying that, be humble, just be uh, try not to be I would say bossy the first day. So try to accept, be friends with your SHO over there. They use senior house officer. So my senior officer were very nice, British lady. So at that time, I still remember I assisted as a third surgeon for a triple A in the first week of
Oh,
housemanship.
wow. Triple A.
Chief surgeon. And at that time, my SSO is outside looking after the ward. So I have to assist my two consultants, the two vascular consultant. And then even during that time, even in between of operation, and they say, Norman, can you please go to the ward and update us with all the patient? So I have to scrub off, go outside the OT, go to the ward, look at every patient, the patient, and then after that, I come in again and report it direct to the consultant as a houseman. Compared to here, they have a senior also MO or registrar will report. But during that first week, I have learned that. But because of what this one I rely all my seniors that have taught me how to do it, how to train, how to communicate. So I've learned it. I have to learn it very fast. So at that time, if you try to be humble, I mean, you know that you tend to make mistake. You keep asking. Basically, the easiest person you ask, as what Prof Hai said, is your nurses. The nurses will tell you, fill this form, use this form. This is the dosage that we use. This and everything. Basically, the nurses basically take care of us even during on calls. Even though a night shift is a 1 week straight night shift, obviously you don't have time to eat. So when you are nice to the nurses, they tend to, because obviously there are extra food for everyone, for the patient, and sometimes the patient tak makan kan, okay. The Nurman, there is some food in the pantry. Please help to serve. So that's how that's
Yes.
how I feel myself during on call, because sometimes it's very busy. Then you don't have time, and because during night shift there's no cafe open. So you are very hungry. You start at PM and stop at AM. Usually 10 a.m. the next day. Obviously the cafe is closed. You don't have the time. But luckily with support from the nurses, uh, I fed myself lah basically. So when you come in a houseman, you need to understand that you are, as what Prof Hassan said, you are the lowest, but they respect you basically. They know that you are a doctor. They know that you will be higher than them. But if you know how to, you respect the nurses, the PKs, your seniors and everything, they will respect you back. So unlike what we listen now, or I am a doctor, I need to be respected. I deserve this. I deserve that. I believe you have to take a step back and see yourself whether we really deserve the way we treat other people. So if you treat other people with respect, they will treat you with respect. So respect each other is very important. Know your limit. Sometimes you are a textbook person, because I have a friend who are a walking Kumar and Clark. He know what page, what level, what color.
Wow.
Yes, I have a person who is a Malaysian, walking Kumar and Clark, but he is very humble. He know the page because he was involved in our grand round, and then if someone cannot answer, we will turn to him. So which page? And which that version of Kumar and Clark. And then we have another one person is walking ganong, physiology.
Oh, wow.
So so we have good friends and try to maintain your friendship with other people, even from other departments, because this is how you, as what Prof Fauzi, Dr. Fauzi, I call you Prof because we know him as Prof Fauzi. When Prof Fauzi said that the networking is very, very important, sometimes you really need the help of other people that you might be struggling on yourself. So sometimes your friends will come in need, and you will go up together, move forward together. That's how you need to be in the first few months of the housemanship. Try to be humble. Try to do everything very fast. Even if when I start working in Malaysia, when I come back, over in the UK they use Venflon. So when I use the word Venflon, what is Venflon? Venflon is Branula here, but Venflon is
Ah,
a brand name. So we use Venflon in the UK, but over here in Malaysia is Branula. So you have to learn very fast. There are things that the initial, the short terms, whatever short. I mean apa ada macam PID, apa nama tu, continue the same, continue the CTT,
ISQ in
ISQ,
Sete.
ISQ aja. Apa ni I said, so I have to learn very fast because in the UK they have a different way. Continue, just see how it. That's it. But obviously, when the consultant knows about it, they memang kena marah lah. Because you cannot say continue, continue. You have to rewrite back what you have done in the past that has not been done. So that's how I learn. You have to learn very, very fast, especially during the first few weeks of housemanship. That's what I can share lah.
Thanks, Dr. Nurman. And I believe one of the take-home message here, please kanching with your nurses in the hospital if you want to survive your housemanship. So
We want to
and,
hear Dr. Fauzi's experience on his first day of housemanship.
yeah, sure, Dr. Fauzi. Do you mind sharing with us as well?
Okay. My first for housemanship for me in UK, maybe if I tell you, say alamak, relaxnya, pamperednya. Okay, orientation first. We had proper orientation because I applied. Okay, in the UK, during my time, we can apply for jobs. So jobs are called firms. So housemanship for 1 year. One firm is for 3 months. You work, and then you rotate through the firms. So there will be a list of rotations. So I chose a rotation which I liked. So and we can lobby for jobs as well. So I graduated from Sheffield. Nurman knows Sheffield very well. And I applied to work in a hospital called Northern General Hospital, which is a really, really big hospital, like HKL. Where there are hundreds of consultants. So we can apply what rotation we want. We can put that choice 1, 2, 3, and then you can lobby for the job. So all medical students would approach the consultant saying that I'm so and so, I'm really interested in your job. So during the interview, they remember you, and then they'll be, okay, I want this medical student, this final year medical student, as my houseman when the job comes out. So I got my first choice, which was internal medicine, stroke endocrinology, and then I went to nephrology, general surgery, and then orthopedics. And
you did not do ONG, obviously.
in UK, we did not need to do ONG in pediatrics. Thank God. When I did my pediatric posting, I got a little bit put off because going into NICU and PICU, I would always get cough and cold after that. Later on, I realized that I'm asthmatic. Doing pediatric posting during my medical student days put me off pediatrics, so I became an adult internal physician, internal med physician. Anyway, that's a different story. So the first week was orientation, and after that we were eased through. But again, the same advice. I echo the same advice from Dr. Noah and Prof Har. Be humble, work hard, be willing to work hard, ask for help, coaching with the nurses, the sister of the ward, know them by name, and the nurses like it when you work hard, you respond to your pager, you sort out the patient as best as possible, and if you have that extra thing we call soft skill, being kind to patients and their relatives, talk to them properly, and you will fly. So I went through housemanship without too much difficulty, but because of course it was hard work, and because of that hard work, I managed to get good recommendations to get future jobs. For example, now I'm digressing a little bit, but when you work hard and you do your networking, getting future jobs is not going to be that difficult. I was a foreigner in the UK, but I never failed in any job interview. I always get the first choice of whatever I applied for. So when I applied to do over there, it's not called MO, medical officer, it's called SHO. So I applied for a 3-year rotation in Manchester, in a hospital called Trafford General Hospital near Old Trafford. So I moved to Manchester and applied for a job, and I got a 3-year rotation, which was a rarity. Normally, for foreigners to apply for 6 months job pun payah tau. Susah. Nurman, would you agree with that? No, the Indians, the Pakistanis, when they come to the UK, they send the CVs hundreds of hospital. Sometimes if they get a one job interview, they're so happy. But I sent one job application, I got that job, and it was a 3-year rotation. And in that 3rd year, I became a registrar. So that's the job hierarchy. So I did 2 years as a senior house officer, equivalent of MO, and the 4th year as a doctor. The 3rd year of that rotation, I became a registrar. So I was in charge of 2 teams. So I had two as a junior SHO and 2 housemen under me as a 4th year doctor. So if you work really hard, you try to gain as much experience as possible, you network with everyone you can network with, your colleagues, senior doctors, nurses, they can actually write a really good reference for you, and you, inshallah, you can get good jobs. And alhamdulillah, I managed to do that. But is the key here is communication. You need to be able to network and communicate very well, and being fluent in whatever language that you speak, I think, will be of benefit as well. So if you are able to communicate well to patients, well to the nurses, well to your colleagues, well to senior people, I think you will put yourself in a good stead.
Can I just share how big is Northern General? Northern General, because I'm also from Sheffield as well. Northern General is so huge that if everyone on call, you use a bike to go to the ward. Koridor tu punya besar. Memang dalam hospital pakai bos basikal kan? Kalau on call kan?
No, at that time, no, we had to run. We had to walk fast from one hospital, from one end to another.
Okay, Jun.
They use bicycle.
Okay, these 2 guys are bragging about how big the hospital was. Let me tell you about how HKL during my time. When I was doing medicine, adult medicine after my pediatric for 3 months. Every admission, you will have maybe 30 admission that is going to be on the canvas bed. 30 on top of whatever bed is there. So okay, sorry. And it is like, oh my God, you could hardly walk, in between the knee. I feel like Florence Nightingale, like I was just walking, and then somebody would just hold my kain and say, "Doctor, sakit, doctor." Aduh. Like I do not know what to do. I want to cry. But looking back, and that is internal medicine. ONG, we have a postnatal ward that has 70 mothers with 70 babies. This is a low risk postnatal. And it was, even now the ward is no longer there. It's just like the estate hospital. But mothers who just delivered a few hours, they are on the canvas bed. Okay, and this was really something that I cried almost every day after I cry because I feel that this is too overwhelming, and I pity the patient. All right, and I remember holding, the medication punya bottle pun style lah kan, because they are all having all the uterine cramps, and I feel like Mother Teresa, giving to to. Oh my God! But that was really the one that make you who you are. All right, just we're not supposed to sort of scare you out of your wits, but please look forward for your housemanship, because it's really going to be very memorable, very significant in your life actually. Okay.
But I guess would be a problem for me since I don't know how to ride a bike. So yeah,
Oh, you buy just Segway, the one that is you can just stand and walk
That
around.
still is not truly necessary for housemanship.
June, I think there are those who are actually with us. Can actually write some comment or questions, yeah, on there, so
yeah,
we know that you are around. Okay, so we have here Sarima Basra. Of course, in Akademi Dr Har, we don't really care about how many viewers we have, because the number will actually starting to grow. Because that is the good thing about having this platform, yeah, Nurman and Fauzi. You can start off with only maybe 30 or sometimes just 10 people, but as it actually, the time goes, it will just add on. So but we really want to interact with our kata viewers as well. Okay, Jen.
thank you, Prof. Perhaps I should start to train my stamina now. Walk fast, run fast. So
You do
yeah,
need stamina. Yes. That's
Yeah.
why I mentioned about health. Yeah.
Hmm.
but I can't wait to start my housemanship. And actually, I've been hearing and seeing junior doctors quitting medical practice because of various reasons. So back to you, Dr. Noman. In your opinion, is it actually that important for us to complete our housemanship?
Okay. I mean to tell you the real scenario. It depends on you basically. If you really want to be a doctor, then you must complete your housemanship. And if you want to be, breaking to call yourself as a doctor, you must have finished housemanship. The issue is, obviously there are some people who are able to pass medical school but unable to be a doctor. Memang ada. There is always people are like that, who are able to excel in medical school years but unable to excel in front of people. And for me in medical education, we have to accept there are that kind of people, and there are always other ways that they can go out. They might not be able to do housemanship and to do something else. Why finish housemanship is very important is in terms of full registration. When you have your full registration, you can do anything. Why I say anything is, at that time you are allowed to do locum. If you don't want to work in the government, you quit. But when you have a full registration, you are considered a fully registered medical practitioner in Malaysia. So, because you never know that maybe at that time the situation doesn't permit you to be a doctor, and then you need to take time off. But when you have APC, annual practicing certificate, then you can keep it and keep paying it. And then maybe after a few years, you decided, yes, I'm coming back to clinical practice. So you never know. Uh, but if you don't finish your housemanship, because in Malaysia, housemanship is a one-time offer. There will be no repetition as far as I can remember, because of the huge number of graduates. So if you want to struggle, you struggle the first 2 years. Once you get your APC, once you get your full registration, your option is to continue or to rest. That's how I can make it as a general moderate. Orang biasa je lah, not as an excellent doctors like some people who will want to just everything just go ahead, go to MO, master, consultant, everything, specialist, everything. But there are some people that might need to take some time off. So that's how important housemanship need to be completed. As I said earlier, it depends on whether you still want to be career in medical doctor, because I have a few of my, I would say, juniors, friends, everything. They, after they graduated, they decided not to continue, and they involved in real estate. They want to do takaful, insurance, everything, and they are successful in in their field. Maybe there is what we call this the fate of what they want to be, even though they are graduated from medical schools. But for people who really want to continue in the medical or in the health pathway, housemanship is a must. Yeah.
June, can I add on to that? Um,
Yeah, sure.
of course, definitely, housemanship needs you to be, the stamina is not just physical, but it's your mental stamina as well, which can be very taxing when you have maybe unrealistic expectation of yourself. Uh, uh, of course, the most difficult part is actually uh, taking on the responsibility. Okay, and this is what I'm sure you know that I always highlight on the clinical reasoning, where the product of your clinical reasoning is your diagnosis in plurality, yeah, provisional and also your differential diagnosis, and then treatment plan. It can be the immediate, intermediate, and long terms, and of course, you need to prognosticate your patient. Now, this is these are the expectation of everyone on you once you are being a doctor. And if you, of course, you are not perfect, yeah. So if you are the people that has always been excellent and you never actually encounter any hiccups in your life, then you will realize that when you become a doctor, life is not like that. It's not black and white. You will make mistake, and you have to stand by your mistake. Of course, you feel guilty, but you still have to go on with your guilty when until you have your first death. And you know that it is because you are late in your dosage is not being right or whatever. You have to live with that. Everybody of us medical doctor will always remember the first patient who died on you. Okay, and because it actually haunts you. Okay, so this is what I'm trying to say. You need to have that mental stamina. And in fact, Academi Dr Har feels that this BUOY, your project, is like keep you afloat. And I think this is the time, June, to be very realistic about your expectation, and to know that you have your strength and of course your weaknesses. Dr. Fauzi said it just now, your weaknesses is for you to sort of look into it, yeah. But that would not be the same as immersing yourself, in the deep itself. So be prepared, and always. I think I really like the advice, where Dr. Nurman and Dr. Fauzi has emphasized, always be ready to ask for help. All right, and I guess not too late. It's always too late, too little. Then by then, it's just too heavy, and you just break and you become broken. Yeah. All right.
Thank you, Prof. So how about Dr. Fauzi? Do you have like any advice to us as well?
I think regarding your question, should you finish housemanship? I agree with Dr. Norman. Try to finish your housemanship so that you can be fully registered as a medical practitioner in Malaysia and get APC. And after that, you can decide whatever you want to do. But there may be people who are not cut out to be a doctor. So you've got to decide what's the best for you. I think in this day and age where physical and mental health is important, previously, doctors used to suffer in silence. I think Prof. Har, Nurman would agree. People used to suffer in silence. They think, I'll just plod on. I'll just survive this by hook or by crook. But nowadays, we know that physical and mental health is truly important. You do not need to suffer. If you think you're not cut out to become a doctor, then again, ask for help. You may be right, you may be wrong. Speak to someone, get proper counseling, ask around, are you making the right decision? Or could you tweak something? Could you modify something? Could you change something in life so that you can be a better doctor and get your, and then finish your housemanship? So just be honest with yourself.
Okay, doctor. I agree. Yeah, no one is perfect and always ask for help when needed. And that's why, as Dr. Fauzi keep on emphasizing, networking is very important. So, so once we have completed our housemanship, and for now we'll be actually under contract base. So what's your opinion, Prof? Like, if is there anything that we can prepare if we are interested to become a lecturer?
Okay. Um, well, I need to sort of reflect back on my, how I landed myself in academic, yeah, and even still so after 30 over years. Uh, in UCAM at that time, it started off maybe, a few years before me. So this, I actually know this because uh, the MD would be sort of ranked. So the first the top 30 student after professional exam that you underwent on in December gitu kan, June. So the top 30 will be offered, a place to come back to UKM under the SLAP program, sistem latihan untuk pensyarah muda. So I know that, and I really want to be a teacher. uh, and I know what discipline that I want to be. So it's ONG, kan? And I was aiming that I should be in that top 30. Okay, so Alhamdulillah, I got distinction for my apa? I think June pun kan? You got honors kan, June? Is it honors or distinction?
Honest, Prof.
Yeah, okay. Fauzi, this is an honors student, okay? So, at that time, kita tak ada honors lah masa tu, June. It's very difficult to get honors. But I managed to get the distinction. So, within 2 weeks, of course, I already married kan, the first week kan. 3 weeks later, I got this letter from UKM. Diterima tawaran untuk menyertai program latihan pensyarah muda. So they offered me the job. Cumanya I have to serve 1 year under KKM. And then after that, actually my name was already going to KKM. Even before I actually enter my housemanship, because UKM is already telling KKM that this is going to come back to us. And so masa tu I got this perletakan jawatan dengan izin. So I actually resign from KKM. That is actually the system for me to go into Kementerian Pendidikan lah masa tu, So I know that I just going to serve 1 year aja in KKM because I already gotten a place for my ni. And that letter, I was asked to name which department, which discipline that I want. So I know it's going to be ONG. But okay, I need to tell this because now that I have to decide together with another person who is now my husband. Kan, kalau tak dulu, it can be just me. So when I got that letter, half of me feels that, okay, you can just say, oh tak mau lah, you don't become ONG specialist, otherwise nanti who is going to look after me, blah blah blah. And then I said, well, if God going to ask me, why are you not, why didn't you continue as an ONG specialist? I said, don't ask me, ask him, because in our relationship, of course, the husband, has to be more or less giving you your his opinion, and in that case. But half of me says that please say yes because I need to do this. It's becoming something which is compulsory for me as well. So of course we know that he said yes, and then we go. I actually resigned 1 week after I finished my housemanship. That was just one 1 year, and in 1992 I came back to UKM, all right, as a pensyarah trainee lecturer. So at that time, I have not done my surgery, Mr. Nurman. So I was in surgery for about, I think, 6 months. And that was the time where I worked under the vascular team. Got to know Prof Mia. And I think during that time, the DG was one of the trainee lah, juga a senior trainee. And then the last 6 months when I actually prepare for my MRCOG part 1, I was in the anatomy department teaching a first year student as a tutor. So actually I did dissection, and that was really good in preparing my for my MRCOG, which I passed the first attempt. And after that, I'm from 1992, I enrolled into the master's program for ONG. So Well, of course, looking back, I did not have the experience of working here and there. Pergi Labuan lah, pergi Sabah lah. Maybe that is something that I miss because my experience is all in UKM. But I guess I look at it as, yeah, I might not be having that, but whatever opportunity that I have, I sort of try to maximize that, and I become a specialist in 1997. So 6 years after my graduation, and immediately then I become an educator and academician in UKM. You see, I graduated as a specialist in July 1997. We were still in HKL at that time, MHKL lah kan masa tu. And then I delivered my third child. So I went into full-fledged maternal leave. Before that, I actually had just half of whatever it is because I'm a trainee. So but when I came back, we were already in Cheras, our HUKM. So my the experience of being a specialist for me is as long and as old as HCTM itself. So I remember at that time PAC was just, there was all open air. When we see our patient there, sometimes it's raining, sometimes it's so cold because we are open to the chilly night air. But then I was among the young specialists who designed that together with our pembangunan, so that it is now as what PAC is. But of course lah kan, Fauzi and Nurman, when you come to this age kan, orang tak tahu pun. I je lah yang tahu, macam mana as a specialist, I actually sleep there with my nurse because the safety of the nurses kan. And so of course our security pun masa tu tak cukup lagi, nanti cerita lah ya. So as a specialist who's in charge of that part, I remember sleeping there, with my nurses when I was on call, because that is part of the responsibility of the specialist on call, to look after the PAC punya ni. I need to write that down, otherwise most probably it will just go off without anybody knowing it kan. But that is actually the I would say I have no other choice agaknya, June, but to become a teacher. But I actually, no, I would say I know that is actually my destiny, and I don't regret. Yeah, I don't look back with a lot of remorse. I think it's meant to be, and alhamdulillah, just like Dr. Fauzi and Dr. Nurman, again, we actually need to focus on what we want and just go for it. Okay, June.
So we got to hear about Prof. Har's journey in becoming a medical lecturer. So if let's say we are interested in just becoming a pure physician, is there any difference, Dr. Fauzi?
Let me digress a little bit from your question. There's no such thing as being a pure physician. Because your question will be, I know your question, clinician versus educator versus lecturer. To me, every single one of us here is an educator. You may not be a doctor, but you're an educator to other people, to your colleagues, to your friends, to your family, husband, wife, children, even to parents. You're always an educator. Do, Prof. Dr. Nurman? Yeah? You're always an educator. Okay, but then, of course, we have our division of labor, what we're going to be paid for. So I'm a clinician plus educator who enjoys teaching. So when I was going through my senior housemanship, I realized that I can teach. Because there was one time a group of nurses asked me, can I set 1 hour to teach them on certain things about respiratory? And I did that without much preparation, just a whiteboard. And I went, and at the end of that session, the sister and actually one of the nurses said, Dr. Fauzi, I was called Dr. Anshar at that time. Yeah, Dr. Anshar, you're actually a very good teacher. So it struck me. So I think I've got a passion to teach. So that's why I was interested to become a lecturer, and I actually applied when I came back to Malaysia. I applied applied to be a lecturer. I actually
Fauzi,
applied to UAE
Fauzi,
first. Yes.
it's not a surprise. You're a child of two teachers, kan? Because
Yeah, I mean,
okay.
my late father was a teacher. True. My mother was a clerk. But I have plenty of teachers in my family. So the passion for teaching was there. I actually applied to UIA, but I got pushed to go to come to UKM. But the rest is history. Um, so everyone is always an educator. I was a clinician who had a passion for teaching, and when I was in HUKM, I learned other things as well: to become a researcher, to become a supervisor, to become a collaborator, um, and many things. We wore many hats: administrator. But as a doctor who goes into clinical medicine, I'm a clinician. That is my calling, because when I'm a clinician, I can do many things as well. I can educate, I can diagnose, I can prognosticate, I can treat, I can follow patients up. So, as a doctor, we wear many hats. It all depends what proportion you want to allocate to certain things. To me, I'm an educator first and foremost. I left a job as lecturer, but I still would like to teach. Every opportunity that I get invited. Yes, I will also say yes, especially for her. I can never refuse for her. But then yes, I'm a pure, well, not pure clinician now, but I do more clinical work now. That's right.
Thank you, Dr. Fauzi. Yeah, as a doctor, we actually have multi responsibilities, and being an educator, being not only treating patients. So, how about you, Dr. Nurman? What actually makes you decide to join medical education?
Okay. First and foremost, I'm a late bloomer compared to Prof and Prof Hauzi. I've joined medical education quite late. If I can say how I mean, try to be in the academic world, because uh, in the UK, when you are a houseman, there is a contract written in there that you need to teach and supervise final year student. And then when I become a SHO, it's also there's a in the contract there is a clause saying that you have to also to guide the houseman in order in their career. So from that, uh, during my housemanship, I did some teaching for the final year students, because the hospital is very far, because work in Scarborough is very far from any medical schools, and my second posting was in Whitehaven, Cumbria, near Scotland. It's also still very far from any medical schools, but the medical school do send some of their students there. So I take the opportunity to teach them when I was a houseman, and also take the opportunity to teach the houseman when I was a senior house officer. At first, for information, I was in clinical for the first 7 years of my career life, mainly in surgical. Uh, so I tend to just cut people out and then treat them everything, all the normal thing that surgery do. Basically, it's a pure surgery for 7 years, and then for information, I've entered master in surgery first, but unfortunately, tak ada rezeki, so I've I have changed to medical education. Initially, in 2006, UK started to introduce what we call academic medicine as a specialty, apart from the other clinical specialty. But at that time, when I came back in 2006, it is not as established as now. So when I come back in 2006, medical education was not established in Malaysia. So surgery is my only option at the time when I joined UNIMAS as a trainee lecturer. So I've gone through the training. Unfortunately, I didn't pass my first exam, and then I decided at that time I met Prof Nabisha at that time, and then I was the first batch as a medical education in UKM, and then since that it's history until now lah. So I've done my master in medical education in 2010, graduated in 2011, offered by UKM to join UKM in medical education in 2012, and now I've completed my master in 2011, and now I have completed my PhD in medical education in 2019, and now I'm in medical education for the past 10 years. So that's my journey. Um, I don't know whether it's been there lah. Nah, apa? Memang the thing that I like to teach or I like to guide people. I like to talk to people, and that really pushed me to into the really pure academic side. But I didn't forget my my clinical lah. I saw the some freelance a lot of them because I really need that experience because being a medical educationist, being a pure medical educationist with a medical degree, you must know from year 1 until year 5, and you must keep up to date, and you must have a very good networking with your fellow colleagues to know the up to date training and even training system, either parallel way or master program, everything, so that you can keep up and advise the current generation or in the future generation. So that's what medical education now lah. So that's my history. Yeah.
Yeah, June, there's a question from Liling, I think, in the comment section.
Yeah.
You can bring that up. Okay.
So Liling would like to ask, may I know, is there any difference in terms of master program and parallel pathway to become a clinical lecturer? So yeah, any takers maybe?
I think Dr. Nurman would be the best to answer this.
Okay, this is my territory. Okay, there's a Malaysian system with a master program, and the parallel pathway is the UK program and also an Australian program. Okay, for master program, it leads to specialization. So you become specialist. It's a 4-year program, clinical program. So this is looking at the clinical lecturer side. So it's a clinical master 4-year program. But for parallel program, you have to really be careful because there is a recognized list by JPA, senarai ijazah lanjutan yang diiktiraf oleh JPA. For example, if you want to talk about medicine, you can take MRCP, and after you pass your PACES Part 3, I don't know whether Part 3 or PACES, you become a specialist after examen. But for surgery, MRCS does not recognize as a specialist degree. You have to go to FRCS. So you have to be very careful on what specialty that you want to do if you want to do parallel pathway. Make sure it is recognized in Malaysia. For example, if I can share one of my colleague who just returned back from Ireland, she's a medical graduate. She has a master degree in dermatology. So she's a dermatologist. Work as a dermatologist in Ireland. But when you come back in Malaysia, her master in dermatology is not recognized as a specialist degree. So she cannot be a specialist. She can only be a medical officer who have interest in dermatology. So the only way for her to be a specialist is to do MRCP first before coming back home. So that's why for master program, it's quite straightforward. But for parallel pathway, you have to be very careful of what you want to choose. Because even MRCOG is a 4-year program, parallel pathway, but you must be in a recognized hospital. You cannot just put anywhere, everywhere. It has to be a recognized, certified hospital by the Royal College of OAG. Also same as other pathway, but this one you have to refer back. That's what I can answer. But that one is just to be a specialist. The next step is to apply to work as a clinical lecturer. That's a different process. Being a specialist is the master or the parallel pathway, or even if you are very rajin sangat, you can do both. A lot of people do both. They do master surgery, do MRCS, do FRCS, a lot of things, and then they are considered as specialists. Then if you have to join the university, then you have to apply as a clinical lecturer. But don't forget, clinical lecturer still got the we call it I call it STAR, service, teaching, admin, and research component when you are a lecturer.
June, maybe I just want to add on. This is where networking is very important, is what Dr. Fauzi has mentioned just now. Let's say, like you can, June, you are our honest student. We would like to have you back, but you have to start making networking with the department that you want to be in, and then well, most probably if you can get housemanship here, then it can actually do a lot more shortcut lah. Yeah, maknanya you can be informed when is the in fact the application to be a trainee lecturer, it might be open because the policy changes kan, Nurman, kadang ada kadang tak ada post tu, but if you are around then it's very easy for us to inform you. Okay, just like the time, like my time is no longer like that, where we were being like macam kena tindik or being tagged tu. Okay, right from the housemanship tu, and we know that after this we have to come back to the university. It's no longer that way, but I still, that is a waste because we are going to lose people like you, Jun. Okay, and hence, but of course now we cannot do like what they have done on my on my part when I was your age, because of the the limitation of so many posts and whatnot. But I guess this is my advice to all of you, yeah, who have for Liling as well. If you really made up your mind that you want to be the next, Prof Fauzi, or Prof Har, and inshallah soon Prof Nurman, kan? So you really, keep, don't burn your bridge, okay? Always tanya khabar what happened in UKM, especially if you want to return to us. And I would really say that the faculty would really love to have you back, our very own, because I'm not saying that Fauzi and Norman is not our very own, no, but it's always, if you're a thoroughbred, cakap pasal kuda lah pula. Anyway, if you are a thoroughbred, it's always, when you are returning to your alma mater, it's really, you will always give that extra bit, of loyalty and that kind of thing. So, just to maybe wrap up, for my part, any one of you who wants to join in, and of course I'm going out now. I need to, the faculty needs more new people coming in. So I guess, just focus, and in no time, inshallah, you'll be coming back to the faculty. Okay, Jun.
Thank you, Prof. Har, for the advice. So, how about you, Dr. Fauzi? Since you have all the experience in joining the KKM and also joining the UKM and as well as the private, do you mind sharing with us what is the difference in terms of the working environment between KKM, private, and also teaching hospital?
How much time do I have for this? Okay, so I try to keep it precise and concise. Okay, just a disclaimer there. I've never worked I've never been employed by KKM. However, I have worked in KKM hospital when I was doing some attachment in Kota Kinabalu. I loved it there. Beautiful people, beautiful place, and the doctors there. I have fond memories of my attachment when I was in Kota Kinabalu. So from the UK, I joined straight to become a lecturer in Faculty Perubatan UKM. And I joined as a senior lecturer. At that time, UKM just introduced the senior lecturer post, DU51. So I was, that was 2004, January. I was the first ever DU51 in the whole of Malaysia at that point of time. And some people maybe didn't like someone parachuting in from outside. Dia lah cakap pelik kan, cakap accent macam-macam, lepas tu terus
betul you. I still remember, this buzz in the faculty say, have you met that new specialist coming from UK? Okay.
So I think, okay, thanks for remembering. So it means that I've left a mark in the faculty. So I joined straight. I thoroughly enjoyed my time in UKM. Really, as I mentioned, I wore many hats as a lecturer, clinician, administrator, researcher, collaborator, just to name a few. I became deputy head of department unofficially because there was no paid job for that. I became acting head of department from time to time. I didn't really like the paperwork, lots of signings. Kena menyelesaikan masalah orang ni lah gaduh dengan orang tu lah. Tapi that's a different story. But I had to make a choice. Just to let you know, I took pension scheme, believe it or not, because I've always had the ambition to be a professor of medicine in UKM. However, reality bite. At that point in time, I had to make a decision. Certain there were certain things in my life that happened. I don't mind sharing this. I have a son who has autism, and I needed to make a decision at a point of time. I had many offers to join private hospital. I kept turning them one after another. I just said I want to serve my people, my country, and I enjoyed being UKM. But life, uh, s- what's it? How should I say it? Things change, reality bites. So I had to make the decision because I was on a pension scheme. At age of 40, I had to make a decision very quickly because if I joined private late, then all of that years of pension will be burnt, unfortunately. So because it was an opportunity, I had to make the tough decision to join private hospital. That's why I am now for the past 10 years in Prince Court Medical Center. But let me tell you that that was the toughest decision that I had to make. And leaving HUKM was the day that I left HUKM was the saddest, one of the saddest day of my life. I actually cried.
Mine too. That was the saddest day of my life as well. Because I have lost my PPD advocates and my PPD camp commander.
Yeah.
Yes,
Repeat strong friend.
I thank you very much. I certainly love working with Prof Har, Dr. Nurman, and the rest of the medical education department. So I joined private, and being in private hospital is pure clinical work. That's true. The way that we function is a little bit different, whereby we balance many things. In order, we have to try to give the patient the best care, but we have to always keep cost in mind and always try to be as ethical as possible. So juggling all those things, and me being a advocate of PPD, where ethics is very important, I am. Some patients call me garangnya Dr. Fauzi, but I always tell my nurses and my patients, I'm not garang, but I'm kind. I am kind but firm because there are certain things that I tell my patients I can't do. For example, they ask me, oh, boleh tak tulis an insurance form? I just say I have asthma 2 years rather than 10 years because I did not declare to my insurance company I've had asthma for 10 years. Those are the things, ethical things that I have to deal with, the private doctors have to deal with, ethics, and trying to do the best for patients within the budget that they have. Some of them may use insurance, but it's unlimited. Sorry, it's limited. Some of them paying themselves. So how can we treat patients the best way that we can within the budget and within the ethics that we are bound by? And if let's say they really can't afford to stay in private hospital anymore, that's why my networking with various consultants and specialists in public hospital is useful because if patients say, oh doctor, saya dari Kuantan, I need to go back to Kuantan, I can just pick up the phone, okay, I can recommend you this doctor in Hospital Tengku Ampuan Afzan and this or this doctor in UIA Medical Faculty, they've got a brand new, spanking new hospital there. So that's why networking is really important. So always be humble, always be kind to your juniors because your juniors will become your colleagues, sometimes they become your bosses as well. And it's important that you don't burn your bridges. Always be on good terms with other people. And I think your life will be easier if you keep it that way.
So when Dr. Fauzi mentioned, yeah, garangnya doctor, yeah, all the memories come in back in med school. We used to classify our lecturers being benign or malignant. So
Hawk or doves.
yeah, so how about Dr. Nurman? Is like other than becoming clinicians or lecturer, do you have any like suggestions? Is there any other alternate pathways for medical graduates?
Okay, talking about other alternative pathway from clinical compared to many years ago during like and Prof Fauzi, most of the time KKM is only focusing on the clinical side, but nowadays there's a lot of opportunity. Even the HQ, I mean things like the Perkembangan, CCAPs, everything, they have the opportunity to further study. They have been even sponsored by HLP, go to overseas to do their master, to do their PhD. Uh, there's sorry, NIH, National Institute of Health. They are sending people. I mean, their doctors I
Researchers.
mean, as a specialist in labs like hematologists or everything like that. There's a lot of opportunities now. So it all depends on you whether you want to do. I mean, if you don't want to do clinical, there's a lot of things, whether non-clinical, lab-based, or either medical sciences based, either in KKM or also in university. Because last time, if you don't want to do clinical, it's always university. But nowadays, there's a lot more opportunities. Even you can do your hematology in NIH, in apa? Uh, there's a lot of institute in KKM now that allow you to proceed even though you are not in a clinical. So there's a lot of things now. I mean, one of it is medical education. Is a non-medic. I would say medical education itself is a non-clinical, non-medical, non-laboratory. Is more on the management side. But we must know what is the clinical, what are the non-clinical, what are the lab. So we have to know. That's what medical education lah. Just want to share. So basically, there's a lot of things that you can pursue in medical career. Either even my friend who is in CCAPS pursue in master in public health, become an administrator, and now doing PhD. So become still in KKM. So nowadays the opportunities are there. So please do as what Prof. Fauzi said. The networking is very important. Sometimes you don't know that what are things are ni. Is that is where you try to network with your other people, your colleagues, your seniors, everything to know more what are their job. Even for me, in order for me to answer this question, I must know who are in NIH. I must know who are in KKM. I must know who are in CCAPs.
Yeah.
CCAPs deal with private clinics, so I know it. So that's how networking benefit you for in your medical career.
Thank you, Dr. Nurman. I guess we are almost there to call it a day. Perhaps just to wrap up, can Prof and doctors share with us what would you do differently if you were to face housemanship again? Perhaps we start with Dr. Fauzi.
Oh. I
Oh,
think,
sorry.
okay.
Okay. Habis Nurman, so I just have something to add if I'm permitted.
Yeah, sure.
Okay. So I missed the last few seconds there. I got disconnected. As a doctor, after you have your license to practice, the world is your oyster. All Prof that Dr. Nurman said is absolutely true. But there are so many other things out there. Previously, people who got frustrated with government service, they would join private to become GPs, for example. But to become GPs nowadays, where competition is tough, you must be properly trained to become GPs. You can't just be a GP that handles cough and cold only, because some GP practices have actually closed down during pandemic. So you must be able to provide good quality service as a GP. And again, there's industry, for example, pharmaceutical industry also need good doctors that can handle the admin, promotion, marketing, ethics, research, etc. And don't forget, it's not just Malaysia, it's abroad as well. I'm sure many of you know Professor Halizah Mahmud. She's the associate professor of cardiology in Oxford now, but she used to be in the Department of Medicine in UKM before she left us to join IJN and then venture elsewhere. Now she's in Oxford. And I used to remember she asking me personally, can I take her for short cases because she was going for her master's exam and also MRCP. But look at her now. She has grown bigger wings and has shone in the UK. So the world is your oyster, locally and also abroad.
Can I just
Any
what
at
add
home?
because Jun, can
Sure.
just add from what Prof. Fauzi said. Siapa nama? Anak Prof Lokman.
Fadli.
Join the WHO. Yeah, the
Fadli.
NGO.
Lutfi. Fadli.
Lutfi, yes, Lutfi. So apa? The NGO part is also another option for you to venture as
Yes.
a in the medical. Yeah, just want to share that.
Oh. Uh, June, there is somebody who say, may
Yeah.
I ask a question? I guess this is really at the end of it. I do not know. Up to you. Maybe the panelists we can maybe cater for this one question.
Yeah,
So,
sure.
but while G4R 3KI wants to, so I will just do my wrapping. Remember, we are also actually having a lot of opportunity to become. Thank you for mentioning about the NGO, because I think our profession is so close to humanity services. Yeah, so I think I would like to encourage all of you to at least get involved. Yeah, maybe not really full fledged, but at least you must always be willing to provide your service to the community for free. And that is actually this voluntary work. Don't forget about telemedicine. That is going to be very strong coming up. Like what we are saying, that you might be becoming a doctor in the virtual world, yeah, and that requires a different competency altogether. Yeah, because you can still consult. Certain discipline of medicine can be provided through online. Yeah, and now with more technologies coming in, and of course you can actually create your job. That is actually my point. This is the time for job creators, and to me, those in the medical line, like all of you have all the bricks and foundation to create your own job. I don't know what it is, but there are so many opportunities, and you can actually craft your own specialty, and let other people follow your footstep. June, yeah. And while Dr. Fauzi say, the world is an oyster, to me, the sky is not even the limit for you all. Yeah. Okay.
Dr.
Alamak.
Fauzi, is there any take-home message from you?
Um, just a few words. Yes, life can be tough. It may throw spanners in the work, but to me, I hold dear to the point that everything has been written for you. It's destiny. It's up to you to make the best of it. You're never in the wrong place. If there's a challenge, try to see whether there's any opportunities there, and enjoy life.
Okay.
Thank you, Dr. Fauzi. How about you, Dr. Nurman?
Okay, my last take is basically medical career is not only career, it's not an occupation, it's a life. So you have to live your life. I mean, just like what Prof Hai said, join NGO, help people go down to the grassroots of our people in Malaysia, live a life. That's I can say that because medical is a ticket for you to explore the world, to network and live your life. I think that's all for me.
Okay.
Thank you, Dr. Nurman. And lastly, Prof. Ha.
Okay. I think I've said it all. Well, one of the reason for Akademi Dr Har is actually my philanthropy, Fauzi and Nurman. This is not really a profit, making venture. Okay, now that I'm just a few months away from my retirement, I have mixed feeling. Like I feel that I've done so much, and seeing you all, and having the opportunity to touch your life, is really an honor. So I'm really feel very honored to be part of your journey. But then I also feel that when I close this chapter, officially with UKM, I'm opening up so many other ventures. So please, let us all keep in touch. Yeah, and if you need me, any one of you all can. I'm just a call away. All right, and we hope that we can continue this friendship. Uh, what is meant by collegiality is actually, that very special relationship that you share being colleagues. And June, you are our youngest a member of this fraternity and colleague. So maybe I would like to say welcome to the club. Okay, and we'll be
Welcome.
looking forward to sort of work with you. And of course you might be the one who is going to treat me, June, one day, and your batch, because doctors will soon realize that they will become patients too. All right, and as selfish as I am, trying my best to actually train you so that you will be the best doctor for me. All right, thanks.
Absolutely, I
Thank you.
agree with that. I said that actually when I left UKM, if I interject. Um, I do all this because I'm selfish. Because I want to make sure that if I fall sick or any of my loved ones fall sick, I can always count on my ex-students to treat me and my loved ones. So I'm selfish.
As I am in medical education currently, I'll make sure that the
Yeah,
two
thank you.
the two advice will be will be done for our future products, inshallah.
Inshallah. Thank you, Nurman.
Thank you.
Okay,
Thank you
June, you
so
can.
much.
Yeah.
Thank you so much, Prof. Har, Dr. Fauzi, and Dr. Nurman. I believe the audience have gained a lot today. And thanks again for willing to share your valuable experience and advice to all the junior doctors. Ladies and gentlemen, thank you so much for joining us today. Please tune in to our second series on next Saturday, 16 April, same time at 10 a.m., same platform at Facebook and YouTube, Akademi Dr Har. We'll be having seniors from UKM who are currently doing their housemanship to share the topic on housemanship expectation and responsibilities. Thank you. See you next Saturday and have a wonderful weekend.
Thank you, June. All
Thank
right.
you. Stay safe.
Okay.